Good afternoon. Welcome to everyone attending today's webinar, attending today's forum here at Mathematica's Washington, D.C. office, as well as those participating via webinar. As the director of Mathematica's Center for Improving Research Evidence, I'm pleased to start by sharing a little bit of background about the center. CIRE is uniquely positioned to bridge the gap between policy research and practice by offering broad expertise in designing and using an array of scientific research and evaluation methods in diverse settings. CIRE's mission involves three core elements: building capacity to understand and use evidence, planning rigorous and relevant evaluations, and improving research methods and standards. Today we'll explore the standards for evidence-based technical assistance, specifically the use of research and proven techniques to inform TA content, the way TA is provided, and TA's ability to improve policies or programs. I'm thrilled that we have an expert in adult learning and facilitation, Val Uccellani of Global Learning Partners, to guide us through today's discussion. Val has more than 30 years of experience in designing and facilitating learning events using proven adult learning principles. In addition to Val's facilitation today, we have a distinguished panel of presenters, including Michelle Dare and Len Finocchio from Mathematica, and Donna Pavetti from the Center on Budget and Policy Priorities. We'll introduce each of them more fully before they speak. For those of you on the webinar, you'll be guided through the discussion by our webinar moderator, Sarah Forrestal. Sarah is located in Mathematica's Chicago office, but she'll be actively providing updates about the online discussion to Val. Please use the group chat function on the webinar to discuss the reflection questions that you'll see presented on various slides. But also, please feel free to share your thoughts, your reactions, and any questions you might have on the webinar content throughout. Please note that we're video recording today's session and may capture images of some of you in the audience. The video will be posted on our website later in the week. To help ensure the highest possible sound quality for webinar participants, we ask that you please silence all of your electronic devices. Our first speaker today, Michelle Dare, is well known for her ability to translate research findings into workable recommendations to improve public policy and practice. Putting her knowledge into practice, Michelle provides evidence-based technical assistance to states and local communities to help strengthen their initiatives. She has more than 15 years' experience studying public welfare programs, focusing mostly on quick turnaround research on promising practices and policy implementation. And with that, I'll hand it over to Michelle.
So exciting to be here. I just have to kind of take it in that we're here at Mathematica talking about technical assistance and evidence-based technical assistance. And it's an exciting journey that we've been on as a company in terms of figuring out how does research relate to technical assistance and how do you really translate what we know and what we find out from the research findings to the field. So this journey really started for me 15 years ago, more than 15 years ago, when Donna and I were technical assistance providers for the DC government, the employment service providers, their vendor agencies. And we would provide technical assistance in a little bit of a different way. It was really my first exposure, so it felt, that was what I knew. We used analytic methods to really figure out and assess their TA needs. We used data to help inform when we were making progress in terms of helping programs move along. And we were always looking to the research evidence to provide recommendations for program improvement for the programs. It was then that I also met Valerie Uccellani, who facilitated some of the meetings for us. We had lots of different facilitators. They were dynamic personalities that shared really impressive stories and were entertaining and fun and content rich. And Val is all of those things, but she's a little bit more than that. She's very methodical about how she does things and why she does it. And you can tell from her meeting designs and how she facilitated a meeting that there was thought and intentionality about why she was doing what she was doing. And that always stayed with me, and I learned a lot from that experience. So I went on my journey, and I started to provide some technical assistance as I became a researcher, and shared findings back into the field at regional TANF directors meetings. And the format of that was for me to stand up and give a 20-minute presentation to practitioners about my research findings. And let me tell you, it fell flat. They were bored, and if they had BlackBerries at that time, they would have been on them, I guarantee. So I quickly learned that I had to be more engaging. I had to really reach them at a different level, in a different way than in a traditional kind of research academic stand. And I learned a lot through that experience. And that experience then carried me to several technical assistance projects, including the one that I directed today that's called Advancing Welfare and Family Self-Sufficiency Research. It's known as Project Awesome. And really that's about helping states become better producers and users of high quality research. And again, once again, I've learned from the field. Now, I didn't start out my career as a technical assistance provider. I kind of fell into it. My start was in more of the research world as an implementation researcher. And what I found was we would go out and we would do these detailed summaries of these programs, and oftentimes would share it with the sites to get feedback. And they would say, we learned so much about our programs, but as a researcher I had to maintain that objectivity and couldn't go further to say how you could improve your program. But I still learned a lot from that experience. But that urge, that wanting to say, and you could do this, this, and this, was always there. I was also reminded as a researcher the importance of a firewall between the practice community and the research community, and trying to figure out how do you maintain objectivity without getting too close to sites, but providing information back to the sites that you know from the research. So these kinds of tensions as both a TA provider and researcher is really what fueled me in this quest for figuring out how do you balance those two and make it evidence-based provide evidence-based technical assistance. So this forum is really about that, the beginning of that conversation. I love that there are researchers and practitioners in the room here ready to have that conversation. And really what we hope to do through this forum is to start to create a higher standard for technical assistance so that it's quality and objective and still rigorous and provides programs with good information, while also providing parameters around the relationship between practitioners and researchers and how to have those conversations, still maintaining a firewall but making it permeable so that the information can flow back and forth to create a more rich relationship. So I just wanted to start, and I'll go through this quickly because I give a little bit of a long introduction, but the context for this now, why now the importance for evidence-based technical assistance, is that funding is scarce, and programs really need to prove that what they're doing makes a difference, and they're looking to TA providers and researchers to help inform provide that kind of guidance. In addition, as I see technical assistance, and I've seen all different kinds of technical assistance, the quality standards are not well defined. In the research community, we have standards of rigor for all the different types of research we do. It's not so for technical assistance. So again, this need for saying what is good quality technical assistance, and how would we know it if we saw it? And then the other piece of that is oftentimes technical assistance providers lack the analytic skills to really figure out what a program needs and match those skills. If you just ask a program, what do you need? They may not know what they don't know about their programs. So it's really using analytic skills or research skills to really tease that out. So what is evidence-based technical assistance? For me, again, the beginning of a conversation, the beginning of a definition, it's really about three pillars. And it's really embedding research in first the content, how you assess programs, and then also the content that you're providing for the programs so that it's evidence-based. You're looking to what we know from the research field to be able to really share with programs or practitioners or policymakers what's good information, what's credible information, what do we know, what do we not know. So in the content, in terms of what we provide, it's also in the process. So that second pillar is using adult learning principles, what Val will model today, and what she talks about in her work and does in her work, so that it's evidence-based in terms of how the information is provided. So it's built on evidence about how adults learn best and how they can be inspired to apply the information, to understand, to internalize, and apply that information so that that technical assistance becomes transformational, and it's embedded throughout the process. The third pillar, and it's not just self-serving, is building in evaluation to know whether or not the technical assistance you're providing makes a difference. And also, does the program or policy change that the programs really make a difference in terms of service delivery and improving program quality. So this forum is going to cover each of these, and we have presenters that are going to cover that. I'm stuck on my... So also, just Val reminded me, we have in your packets just a quick definition of that, of what I just described today in terms of the evidence, in terms of content, the process, as well as evaluation. And just one other quick piece, there's different kinds of evaluation that you can embed in it, rapid cycle evaluation, data analytics, and other kinds of implementation science techniques that are easy to build in and are useful for the field. So what I want to do now is just pause really quickly and just give you guys a couple of minutes. The next slide. This is a reflection question, and this is part of that kind of modeling and giving you space. I just provided a lot of content to you, and giving you space to kind of take it in and reflect on what we've shared. So the thought question is, in what ways does the TA you deliver, support, or receive align with this description of evidence-based technical assistance? And again, in your packets, there's a handout that defines it. I'm going to be quiet for a minute and just remind you, in the room, you're welcome to share. And then we also have the chat feature online that people can ask questions.
And for the webinar audience, the document was provided earlier.
So any kind of comments, reflections, give some space. There's mics at your table.
Hi, I'm Bob Herudian with Senior Service America. And I'm essentially, I do applied research, but we're a service organization for employment assistance to older, low-income, unemployed people. You've mentioned that it's difficult to understand or have a clear definition of the quality of technical assistance. Do you have a clear definition of the range and scope of what technical assistance is?
It's a great question. It's a great question, and I'd love any other feedback from the audience. I think it varies widely in terms of, that's my sense of it. Any of the panelists add to that? Go ahead, Donna.
Hi. When I think of technical assistance, I do think it has lots of different dimensions. So when we just sort of broadly, I think of when it is someone coming in to facilitate a process of helping somebody to do something differently. That's sort of my sort of very basic thought. And one comment I wanted to make is Michelle mentioned when we did work for the DC TANF agencies, and one thing that I was struck by when we did it was that we had these incredible sort of presenters, people doing workshops, things like that. And what would always happen is we'd go out to the programs and we'd do evaluation forums, and people would say how great the information was and how it would help them to do their work. And when we would go out, we wouldn't see any of it. And one thing that I really sort of realized from that experience is that technical assistance is much more than giving people information. It is a process of helping people to get new ideas often, but also thinking about what do they have to change to do them. Because I think that often what doesn't happen when we do technical assistance is we don't give people, when we do training for people, for example, we don't give people the tools, the space, what they need to be able to actually use what they've learned. They just go back, they're busy, and they do things exactly the way they've done it. I've been in 2 very significant trainings myself where I walked out and said, this is great, and I'm going to change it, and I have never done it. And I think it's exactly that sort of same thing, is that you just get into doing things as it was always done.
Great, thank you. Is there a question from the webinar audience? Okay, great. One more, we have time for one more, and then we're going to move on. Comment? Craig.
Thinking about this, your description of 3 pillars, it strikes me there's a merging of traditions. There's an evaluation tradition where you have very much separate of what I would think of as the passionate people who deliver services because they're not really excited about it, they're not going to do a really good job of it. And the skeptical researchers who tend, if they're not skeptical, well, usually probably not very good researchers. And so there's a whole tradition about that, which you've talked about. But there's also a quality improvement tradition, which is much more rapid, integral to the programs, the plan, do, study, act kind of tradition. And I think as we see these 2 things merging, trying to find a way to get information out faster. So I think the 3 pillars are pretty interesting, but trying to think also about how these 2 traditions merge.
It's a great comment. Great. It's a great way to introduce Valerie Uccelani. She is senior partner and co-owner of Global Learning Partners, and I cannot praise her enough. I've seen her operate for the past 15 years, and she's phenomenal. So I'll hand it off to there.
I'm going to ask you to focus briefly on the second of the 3 pillars that Michelle presented, that is around process. And we're going to focus specifically on methods that include careful design of the learning architecture, achievement-based objectives, and intentional learner engagement. We'll take the next 5 or 10 minutes to just really flesh out a little more, what does that mean? And so to do that, we have a graphic for you that I, over 15 years now, have found extremely useful as a way to really think through the architecture, if you will, of any kind of a learning design. This graphic really succinctly presents what might look like a simple process, but it's not. It's an iterative one that is really driven by an ongoing curiosity that we have about the people with whom we're working, the learners, and the teachers or content providers and subject matter experts. The curiosity that we have about the situation, as Donna was referring to, the real live day-to-day situation in which they will be bringing back whatever learning they take, be it from a webinar event, an in-person workshop, or a TA process. This framework also forces us to define, together with the learners, in dialogue, collaboratively, what's the change we're looking for? And what would be a realistic change to anticipate at the end of this learning process, whatever form that ends up taking. You'll see as we work our way up the pyramid that this framework also helps us to really be realistic about the timing that we have for any kind of learning and teaching exchange, the place or places in which that's going to take place, and then what are the implications of the whole base of this pyramid for really tough decisions that we always have to make about what's the most critical content we're going to offer or include in for learners, and what are the achievements, meaning what is it that people will have done by the end of the learning process to show us and to show them they've learned something. Only then, after we've really established that foundation of this design pyramid, are we ready to craft what is often what we jump to, which is the agenda or the schedule for our TA visit, right? Or the outline of this hour-long forum. And that really is the tip of the iceberg when it comes to thoughtful design of adult learning events and processes. I'm going to invite you to reflect on this a bit, but before I do, I want to jump ahead to another aspect of that second pillar that Michelle was intentional about naming, and that is that design of learning objectives. And what do we really mean by that? So I want to show you the objectives that we worked out as a design team, and we spent some time, didn't we? It really wasn't a 5-minute conversation, but we really spent some time thinking, who's going to be in the room and who's going to be virtually with us for this forum? What time do we really have? What's the situation in which people currently design, implement, and support technical assistance? What's their current understanding about technical assistance and evidence base and about how those two things fit together? And then what can we realistically accomplish in an hour and a half of a blended session? And we laid out these things for you, that by the end you will have identified ways in which the TA that you support or implement is already evidence-based, because we know a lot of it is. You will have explored 2 diverse examples of evidence-based TA, and we're so grateful that Len and Donna could bring us those examples from a very practical, on-the-ground place. You will have anticipated EBTA's potential and the ways to apply it more fully in your own work, whatever that is, when you walk out the door at 1:30. And you will have examined proven principles of adult learning, which we're already doing together here. In order to take the, I'm going to back up and just let you see the snapshot of our time together. Of course, we also had to do that hard work of how are we going to use the first 10 minutes, how are we going to use the next 10 minutes, and how are we going to get this all done by 1:30. But it was all driven by these objectives, very thoughtful, intentional objectives. So let's take a quick look at 6. And it's hard for those of us who've worked in this field for decades to say choose which 6 adult learning principles we're going to share. But these are all supported by some beautiful research that was done fairly recently, a meta-analysis of training and learning opportunities for adults in a number of different sectors, and that meta-analysis really surfaced 6 core evidence-based adult learning principles. And I invite you to take a few minutes right now to quietly scan over. Again, in your packet, I saw some people searching for this packet. Forgive us, it's on the right-hand side of your folder. And as you scan over these very brief, I hope I did them justice, they're so brief, descriptions of 6 evidence-based adult learning principles, please consider this question. Which principles have been most operative in your TA experience to date? Be that experience one of supporting TA, providing TA, or receiving TA. We're going to be quiet for just a couple of minutes, and thank you to the webinar audience for doing this as well. So as some of you are still scanning over that, I'm going to call your attention to one of these principles. Not that it's more important than any of the others, but because I hear in my conversations with Mathematica staff, I hear a lot of questions around this one. And I've had the honor really of doing some coaching sessions with Mathematica staff over the last day and a half, and it was a theme. It was a running theme. I'm also going to bring your attention to it because it's one that we're working hard to model here, and that is the principle of engagement. And as you saw in your handout, engagement is quite distinct from participation. Engagement is carefully designed into a learning event or learning process, again, be it the delivery of technical assistance or the design of this very webinar. So notice even already how we have intentionally fostered engagement in this session. You know, Michelle could have moved right on from a presentation of the three pillars of EBTA, but by inviting some questions and comments, she not only got all of you in this room and everyone online chewing, and really thinking about what she presented and questioning it, but she also invited some of that to come into the room, and the question about what do we mean by TA was such a critical one, and had we not invited that, we wouldn't have benefited from a more common understanding of what we really mean by that. The other aspect of engagement that we're building in is an opportunity for you to do some silent reflection. And I found that particularly in webinars, we are so reluctant to do that. And yet adult learning research, particularly around some great research that's done over the last couple of years around introversion and extroversion, and the power of silence in the learning process, is that we have to be courageous enough to build that in. So with that, I'm going to introduce Len Finocchio, who's going to give you a lot more to think about. This is just one of two examples of evidence-based technical assistance that you will hear today. And after each of those, we're going to pause and let you digest a little and see how what the examples have done for you in terms of expanding your understanding of evidence-based TA. So Len is a senior health researcher with extensive experience in healthcare reform, Medicaid administration, philanthropy, health services research, and advocacy. Before joining Mathematica, Len was Associate Director of the California Department of Healthcare Services, where he managed ACA implementation for California's Medicaid agency. He currently directs the CMS Oral Health Initiative, which you'll hear a lot more about right now. And this is an effort to improve access to quality dental care for children in Medicaid and the Children's Health Insurance Program. Welcome, Len.
You lost my microphone.
Oh. I'm sorry, I was supposed to have his picture up while I said that.
Thanks, Valerie. Is this working okay? Thanks for having me. Just to share that I am living oral health every day because I have a 16-month-old kid and who had his first dental visit last week and got thumbs up. So, because I would have to admit to my colleagues in oral health that my kid has a cavity, which would be really embarrassing. But the whole brushing, flossing, he's really into. And so CMS also understands this importance, and so they started an initiative back in 2010 around oral health for kids. So most of you know this is the world you live in, that Medicaid beneficiaries have poor access to a number of different services, oral health being one of the more critical ones. So what's the evidence of the problem? So this drives most of what we do. Why did CMS act in this area at all? So early childhood caries is one of the most common preventable chronic diseases among kids. And how many of you know that cavities is an infectious disease? And so obviously your dentist has never told you that. So new dad, pacifier doesn't come off the floor into your mouth and into your kid's mouth. Because if I had a lesion in my mouth, it would transfer to my kid. Why that's not common knowledge blows me away. Every time I see my dentist, I'm in his face. I'm like, why didn't you tell me that? Because it's important. So there's evidence that's very well known, years and years of research, but is not part of common knowledge, and it should be. Among kids 2 to 5, early childhood caries is most prevalent among, not surprising to any of you here, kids in poverty, more prevalent than kids who are above 200%, more prevalent among Hispanic kids of Mexican origin and non-Hispanic black kids than among white kids. Again, not surprising, common inequities. Among kids 1 to 20 in Medicaid and CHIP, only 48, less than half have received a preventive dental visit. So all of you know your dentist probably says come back twice a year, which is probably a little much, but at least once a year. So most kids, only half of kids in Medicaid have that visit. And only less than a quarter of them get any treatment. So there's a big, big problem. So the evidence is very compelling. And it has driven CMS to take action, which is really impressive. And other evidence, early preventive dental services for kids contributes to lower costs later. Not surprising at all. So in 2010, CMS started the Oral Health Initiative. It's being led by Lori Norris, which has 2 goals. One, the first goal is to increase by 10 percentage points the proportion of Medicaid and CHIP kids ages 1 to 20 who are enrolled for at least 90 days in Medicaid who have received a preventive dental visit. And the second goal is to increase by 10 percentage points those kids between 6 and 9 to get a sealant on a permanent molar. So when the molars come in, what they do is they go in and they just cap it so it can't get cavities. Right? But it doesn't happen as often enough. And so CMS in its wisdom realized, well, we can't just put these goals out there. So having been on the receiving end of CMS initiatives and directives as a Medicaid official, and Jim can speak to this, and maybe some of the others, you think, okay, well, CMS wants us to do something. Well, here's my list of things we're doing, and this is not going to be high. And we just have too much going on, right? Because we had Affordable Care Act, other things. But CMS realized that, well, in order for states to participate, we need to provide technical assistance to them so that it's easier to do. They have the right data, they have the right skills, they're working with other states that are struggling with the same issues, and so they can actually achieve some of these. So the technical assistance, this initiative is maybe up to 3 years to provide technical assistance to states, and we have 7 main tasks. The first and most prominent is we have a 5-state learning collaborative where we're working with Michigan, Kansas, I always forget them and I shouldn't, Utah, and 2 others, sorry I can't remember, where we are working with them almost every week. So actually, because I'm here, I'm missing one technical assistance call we have with Utah, which is they bring their team to the table and we work with them with CMS, Mathematica expertise, Center for Healthcare Strategies manages the overall learning forum. And we have experts, a former Medicaid director from Virginia and a researcher from UCLA. And we work intensively with states on developing what are called state oral health action plans to achieve those 2 goals that CMS has set out. And I'll go into detail about how we actually do that. And so we also use all of the adult learning principles that Michelle and Valerie were talking about earlier. How do we engage these very busy state officials? We thought about who we would engage and who needs to be engaged in the states. So when the states applied to participate in this learning collaborative, we made sure that they had the dental director, managed care plans, their fiscal intermediary, if they have one, for fee-for-service, the Dental Association, and advocates. We figured a statewide improvement in access to dental services for kids is not going to happen just because the state Medicaid agency is involved. Right? There has to be a lot more going on. So and we were very insistent that each team, all the team members are on every single call. And we send out objectives in advance, we send out materials in advance, and we have reflection moments. And we also pair states one with the other that are like states, that have similar interests, who have similar struggles, and who have similar technical assistance needs, so they can buddy with each other. And I'll share with you how we're using pretty straightforward quality improvement tools, so PDSA cycles and driver diagrams to help them map out their intervention and how to assess their intervention at key points, make improvements to achieve those goals. One of the key data that CMS uses, the 416, the EPSDT 416 data, to show how many kids are getting preventive visits, how many kids are getting treatment services, are not so great. So they've been working with GW to understand, well, where are there problems with these data? So we're designing a web-based curriculum to teach states, state dental officers, their policy staff, their data people to actually input the 416 data in a more reliable and better way, and actually collect data in a better way. So the main piece of data which CMS is using to understand children's access to oral health services, we're helping improve the quality of the data. And we're also working with Center for Healthcare Strategies to develop a performance improvement plan for Medicaid managed care plans. And how can they develop internal quality improvement around kids' access to dental services. So we are working with the states with these driver diagrams. Many of you have probably seen these before, where they basically lay out their strategy to achieve this oral health initiative goal. So to get more kids sealants on their permanent molars. So they identify primary drivers, secondary drivers, and then the interventions that they're going to accomplish. And so we walk through, we've been doing this all week, systematically with every state. What are your drivers, what interventions, and what evidence do you have for using those specific interventions? And I'll talk more about evidence-based technical assistance in a moment. So they get very elaborate, and as you'll see in these second two columns, we ask, how are you going to assess whether your intervention is successful and at what time period? And then they have to identify where they would find these data and how they'll use them. And then as you see, it gets even more detailed as they go along. And so then they come back to these driver diagrams, and we work with them they'll be with us for 2 more years. And they'll get deeper and deeper into their interventions, more sophisticated, more data, and this will evolve over time. So where does the evidence come from for interventions? And of course, it's a mixed bag. The American Dental Association has a Center for Evidence-Based Dentistry. Most of it is clinically oriented, but they do have community oral health and health policy evidence, which we use to support states in picking strategies to use. CMS has done a number of reports, one of which is called Innovative State Practices for Improving the Provision of Dental Services, which is essentially what worked in other states and why. As increasing reimbursement typically works quite well. There's a paper that was in the New England Journal yesterday showing that the bump up in primary care rates for physicians actually worked. It works in dentistry as well. And I'll talk a little bit more about, okay, but what does that do to your state budget? And what that evidence does from wearing my Medicaid director hat. And what I call crowdsourcing evidence. Like in California, would say, what worked in New York? Because it's a big, cumbersome Medicaid program like ours. If they figured it out in New York, we can probably do it here. So as I was mentioning earlier, these goals are all driven and measured by the 416 EPSDT data, and there are 7 dental lines. The 2 goals are lines 12B and 12D. And as I mentioned, George Washington University has been going deep into the data that are collected by states and sent into CMS and finding lots of problems. So we're then extracting knowledge out of GW and putting it into a curriculum that will be web-based with, quizzes and matching exercises for data nerds at the state level, so they can understand, oh, I've been doing this wrong all these years, and now I can do it better. So we're working with GW right now, and then we'll engage a couple of states to help us go through it and kick the tires. So what are the challenges we found with these data? Of course, as you know, poor data means that there's poor evidence and it's very unreliable for planning or for assessing these goals. There's confusion about proper coding, and getting encounter data out of FQHCs and managed care organizations, as you know, is really problematic. It's poor. There's a time lag. And so, as I mentioned, we're going to develop this curriculum in a step-by-step way, which we hope isn't pedantic. and helps people really understand how to better do these data. So what lessons? Of course, many use evidence in a very fast and loose way, and so we try and bring some precision to what we're supporting states with. Evidence is more than findings related to effectiveness, as I mentioned earlier. What worked in New York State, we can probably do that in California. And as always, we need to expand the evidence basis for making policy change. And of course, as researchers, there's all these natural experiments happening right now. So Medicaid programs are adding back adult dental because it's an optional benefit. So perfect opportunity to see what impact does it have when someone has no oral health services for many years and suddenly starts having it again. What does that mean for them? Expanding, of course, the Medicaid expansion to childless adults, like the Oregon Health Experiment, huge opportunity to look at what difference it makes to actually have coverage and access to services. And here's the last one, wearing my Medicaid official hat. I'm looking at Jim. If your Department of Finance thinks it's too expensive, that's really all the evidence they need. It's going to cost us too much. So we had, actually, when we budgeted, when we forecasted California's long-term health care expenditures for expanding Medicaid, we factored in that the rate increase to primary care providers would not go away. So although Governor Brown didn't include it in his budget, but I would guess by the end of September or end of June, it will probably be back, because we figured it would be a very tough, especially when there's evidence showing that it improves access to Medicaid beneficiaries. It's going to be hard to take that away. And I think we have some reflection questions, and I'll hand it back to Valerie.
Thank you, Lynn.
Yes, thanks. Thanks, everyone.
Thank you. So we'll ask you to use two references, if you will. Where'd our reflection questions go? Yeah, there they are. How does this example expand your perspective on technical assistance? So the two references that you'll use are the lessons learned here from Len's presentation and your handout on the 3 pillars. And so take 5 minutes, and what I invite you to do is to talk at your table groups about how this example expands your perspective on technical assistance and what questions are bubbling up for you right now. And we're going to field some of those, just a couple of those questions, and then we'll move on to yet another example. Okay, so 5 minutes at your tables. How does the example expand your perspective on technical assistance?
I'm trying to remember 5 states that are in our learning collaborative.
So if you'd wrap up these conversations and bring them to a pause. So in a moment, we're going to hear a question or thought or two from our friends on the webinar. And then we'll open it up and hear a question or thought or two from the room. But I just want to remind you all that what Michelle said in her introduction of her journey, she said this is the start of a conversation. And that was sincere. The 3 pillars there were put together from a lot of experience, a lot of thought, and as something for you all to react to and massage as a beginning of your own co-created idea of what is evidence-based technical assistance and how does Mathematica and how do others in the field want to live into that. So this conversation that we're having here today is sincerely going to feed expanded thinking around this in the future, no doubt. So with that, let's hear from some folks on the webinar.
Right, so this really applies to the how does this example expand your perspective on TA? And we have a comment in that says, in my experience, TA has often been more ad hoc. The TA team uses their prior experiences and common sense to address issues as they happen to emerge. I had not thought about ways to make it more systematic. So that was really
beautiful. Thank you. Something from someone in the room that you want to bring to the full group? Please.
We talked a lot about sort of this bridge between practitioner and research, and sort of one of the challenges has been even just having more than sort of this impermeable wall is really being in dialogue, because frequently researchers come with this recommendation that they have the solution without a full understanding of the problem. And so I think even some of the conversations we had about, you know, you go to these trainings, you get all this information about TA and don't implement it, because I think part of it is almost this distrust. Like, you can train someone, but if they don't see the relevance or how someone is really looking at their problem and experience and then building from there versus coming with a solution and then sort of hearing the problem as a courtesy dialogue and true collaboration for developing technical assistance, and also doing so in a way that really works in the context and the setting is key. And I think if researchers want practitioners to implement, the conversation has to really change. Like, this whole notion of the ivory tower has to go away if it's meant to be very systematic, using evidence, and also considering that the practitioner may have different perception of evidence than the researcher. And so respecting both spaces and using that information very strategically.
Thank you for that contribution.
Can I add something to that? So having been on both sides, so having been a policy person, an advocate, and a researcher, when I talk with students and with researchers at UCLA, UC Berkeley, wherever, I always counsel them and a little berate them at first to say, the policy implication section of your paper, I assume, is going to be terrible. Because you never get it right. So pair up with someone who's been doing this, so you can really sharpen that up so it really is meaningful to the folks on the other end who are going to do something about the evidence that you've just discovered.
Thank you. And I'm going to run with that segue before I give Donna Pavetti's formal introduction, which I will, just to say that from 15 or so years now of working with Donna, and those of you who know her, I think she embodies that sincere approach to dialogue, bringing her own expertise to every conversation and sincerely learning from everyone with whom she engages in conversation. So it's been a pleasure for me over the years to witness that. Donna is Vice President of Family Income Support Policy at the Center on Budget and Policy Priorities. She oversees the center's work analyzing poverty trends and assessing the nation's income support programs, including TANF. Before joining the center in 2009, Donna spent 12 years as a researcher at Mathematica, where she directed numerous projects examining various aspects of TANF, implementation, and strategies to address the needs of the hard-to-employ. Welcome, Donna.
Thank you. It's always sort of a pleasure to be back at Mathematica. I feel like I really belong here. I feel like I'm still part of Mathematica. So what I'm going to talk about today is a project I've been working on to use executive function concepts and principles to develop new approaches to how we actually serve disadvantaged individuals, and particularly in workforce programs. And before I start, what I want to do is just get a sense of how many people know what executive function principles are, what it means. Anybody? So Heather, we have a few people. Heather, I have to tell you that when I started this, I had a very basic understanding because I happen to have a daughter who has executive function principles, and I had some books sitting by my bedside. But this really was sort of entering into a very different world than where I had been. And so what I'm going to talk about is that whole process of starting from very limited knowledge, which is not where we usually start. So Len was starting from some knowledge about a pretty substantial knowledge base on oral health and sort of what you could draw on. This was sort of moving outside of the world I was used to working in and really trying to sort of say what's out there and how can we use it. So the question was, again, how can we use these concepts to really improve programs? And you can see this is, part of my library that I've amassed in the process of doing this. So part of the context for this is I have done work on TANF programs for years. Now this is not only about TANF, but I'm going to use that as an example because it's the one I know best. So the context here is that we've had modest success in employment programs. Even those that are held up as the most successful still leave many people unemployed. We have a tough labor market. We also have declining employment among single mothers with high school education or less. So one of my favorite charts, which I don't have here, but we often we hear how successful welfare reform was. What often isn't told is that employment among single mothers stopped increasing in 2000. That's 12 years ago. So we can't base success on data for 4 years and leave out the 12 that has been happening since then, and the 12 since then is this decline. So it really, all of this, and cash assistance is actually provided for very few families. So if we're really going to move families out of poverty, the only way we're going to do it is through employment. And we have a tough situation that we're dealing with. So this was really an opportunity to say, can we, through a very different lens, come up with a new way of thinking about things and a new way of doing business that really could potentially improve those outcomes, and both short and long term. So here's just sort of what I said about, just sort of the evidence. So these are 4 of the most effective employment programs we've evaluated rigorously for TANF recipients. So what you can see is that the highest we ever achieved in these programs as far as stable employment, and that's employment in 4 quarters consecutively, is 38% in Portland. So that means the majority of people, after participating in these programs, even though they have significant impacts, are left without being stably employed. So we have a big sort of area in which we can have improvement, and that's really what we're looking at. The other part of this, really the impetus for this project, came completely outside of the world in which I work in, the world of TANF, the world of public benefits. And where it came from was from the early childhood field. And there was a recognition among some early childhood researchers, people who really are experts in that field, that there is a limit, just as there is a limit in the adult world, there is a limit in early childhood interventions. We know lots of things that can improve school readiness, can improve long-term outcomes for kids, but it leaves many kids still behind. And that what that sort of led to was an interest in two-generation approaches, of really thinking of, can we do better if we don't just focus on the kids, but also focus on their parents. And recognizing that if you just focus on kids and you don't focus on what's happening with the parents, that you're always swimming upstream. And so really trying to think about, is there a different way to approach this? And what this did was to bring together people who really live in very different worlds. The first meeting I went to, where I was introduced to this whole project and this concept, I felt like I was in alphabet soup that I knew nothing about. I have my own alphabet soup and I know that alphabet soup, but the early childhood world is not a world that I live in, work in, and so it was really, I felt like we were having two different conversations. And so this challenge was of, how do you really sort of bring those conversations together? The other part of this was that there really are a very few programs who really were innovators, who really started to take these concepts and to say, can we do things differently? And two in particular are a program called Mobility Mentoring, which is in Boston, operated by the Crittenden Women's Union, and something called the Moms Partnership, which is a collaboration in the Yale Study Center. So for me, those were good anchors for having something in the field that was really trying out new concepts. But my starting point was this is a theory of change that the Center for the Developing Child from Harvard University sort of came up with on this two-generation approach. And I was very focused on this second piece of this, which is that interventions that improve the caregiving environment by strengthening the executive function and self-regulation skills of parents will also enhance their employability, thereby providing an opportunity to augment child outcomes by strengthening the economic and social stability of the family. So my task was to figure out, what could we do to strengthen the executive function and the self-regulation skills of parents that could both improve outcomes for parents but also could potentially have an impact on kids. So that led me on a search for information and evidence, starting with, what are executive function skills and what's their relevance to employment programs? The second is what evidence do we have that executive function skills can be improved, or that otherwise paying attention to them in some way will produce better outcomes? So this was really, there was this definition, and then there was this sort of program sort of knowledge. And then, are there evidence-based interventions from other fields that you could actually take and adapt to employment service programs? So this was sort of what I was trying to find. So here's sort of one place where I felt like was my propeller in some ways of telling me this was worth pursuing, is that there is one study, a relatively small sample of a study that Mathematica did of a program in Nebraska called Building Nebraska Families, which was a home visiting program that was not your traditional home visiting program, but was targeted to parents. And what that program did was, there was a curriculum, and it worked on things with like goal setting, which is what a lot of what executive function is about. There were pieces of the curriculum were on time management, they were on financial management. They really were working on building what we often think of as soft skills, which is essentially sort of the core of executive function. And they were not focused directly on employment at all. People were in other employment programs, but what happened in that program is that for the people who had the most significant barriers to employment, they had very, very significant increases in stable employment. So if you remember, of all the other programs that I showed you, the highest that we ever saw was 38%. Here, for this hard-to-employ group, there were 46% who actually were employed for 12 months consecutively. So that's even a higher standard than the 4 quarters of employment before. There was also significant increase in moving from lower to a higher wage job, and for being employed with a higher wage and having health insurance. So all of these, we do not see impacts this big in our employment programs. So this, for me, was sort of evidence that there was something to this. And so it was sort of, for me, again, an anchor to say it's worth exploring this and seeing if we could do more of this. But then I started, a lot of my work was looking outside of our field because one study doesn't sort of give you everything you need. And that evidence had been out there a long time and nobody had replicated it, which gives you some sense of it's not sort of the only answer. So I really sort of delved into, with some other folks, the neuroscience literature. There is this burgeoning sort of industry out there of brain studies, and we are learning all kinds of things about how the brain develops and what you can do to change it. And you know, there is just a lot of evidence about brain development and the whole science of what it means for kids, and less on what it means for adults. If I had to go back to school again, I would go to neuroscience. I was fascinated by the whole thing. There's this other field of self-regulation. There's been lots of research on self-regulation. There's also the kids who have attention deficit disorder have executive function deficits to go with it. So there's a lot of work in the learning disabilities field and the ADHD field on executive function. So there's sort of all of these different things. There's a lot of stuff being developed on goal setting. There's a lot of sort of research out there on goal setting. So I really sort of was in all of these, sort of trying to pull together and say, is there how can we use all of this information to actually influence what we do and to think about programs? So now I'm going to tell you the lessons I learned as I went through this process of trying to learn. One is that I really did feel that the academic research that was out there was relevant to the program world, but it required a ton of translation. And my favorite sort of comment that I got was, I was in a meeting, they've heard this so they'll know what I'm going to say. I was in a meeting and the intent was to bring researchers in this field together with practitioners. There were a lot more researchers than there were practitioners, and they were academic researchers, not evaluators. So I do think there is a difference. Evaluators live in a program world in a different way than academic researchers do. So I was encouraged by the person who was organizing the meeting to ask questions and to push what the practical application of the science that is there, that is coming out of the academic research, was for programs. And one of the researchers, whose research I have to say I found very compelling, I think is one of the most applicable, basically responded and said, "We've done the research, go read it and figure it out." So that was sort of my task. But I do think you had mentioned earlier about that there is different worlds. I think that is very real, and I encountered that. The writing is so technical. I would try and find the least technical articles I could and give them to people, and they're so dense. So this translation function, I think, was a really important piece of what I was trying to do. The other is that I do think there is practice knowledge and wisdom that is really important. So one of the extremely valuable pieces of this process that I went through was I actually ended up working with a consultant who has written 4 books on executive function. And I was reading it as one of the ones sitting in my bed for my daughter, there was one for teens, there was one for children, and I thought, I need this book for adults. And so I feel like bringing in somebody who had years of practice in the field of actually working with real people rather than working in a laboratory setting, which is what happens in many academic, was invaluable in really trying to think through what were the things we needed to think of in the real world rather than in a laboratory context. The other is that I have been totally enthused, energized by really looking outside of worlds. I mean, I've lived in the world of TANF and workforce programs for many, 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 many years. And so really having a fresh perspective was a really good thing. And then the other thing I think that really sort of feels like where we're leading with the heading is that when I started this project, I felt like there was just a lot of buzz around executive function. It was like the new, and the same I feel with two-generation programs, without any real substance to it. And I feel like doing this much more evidence-based look at what do we really know, I feel like what we are doing is building and putting the meat on the bones in a way that is meaningful and actually has meaning to it, and will give us something concrete to actually work with. So just quickly where we're headed and what's next. One is we really are at the point where we've done the research, we sort of massed the evidence to say this is what's out there and brought people together to basically think about developing a new intervention that draws on that evidence. And a key component of that will be really building on some evidence-based approach to goal setting and achievement. And our plan is to actually identify a few states, and we've already started this. Michelle and I were in a 2-day meeting last week, which was so fun. We all learned a lot. We worked together for 2 days, really deeply trying to think about, what is the content and what does it mean in practice? What needs to change in the system to actually do it? And so identifying a few states who are really willing to be risk takers and to really undertake sort of this research and development process to be sort of a part of developing something that will lead to developing tools for practitioners that you can actually then use to implement the model outside of those few sites, providing guidance on how to use those tools, much as Lynn talked about the tools they're developing, and then really building in from the beginning a plan to evaluate it so we really know whether it does make a difference or not. So I feel like we've given it our best shot, to be honest, to sort of try and make it evidence-based in the beginning and use the evidence-based to think about the technical assistance and the design, but the reality we'll know only if we do the rigorous experiments to really test it. And we really, again, are trying to build that in from the very beginning. So with that, I'll stop.
Thank you. So I'm going to be real transparent about why we're doing what we're doing now next. I know, because I've had the joy of working on the executive function stuff for some years now myself, that it's really tempting right now for us to start talking about executive function and about what Donna's been working on. But you know what? That's not the objective of this webinar. If you want to dig into that, contact Donna. She's very available, and maybe even try to get an invitation to an event that the three of us are planning on executive function for next month. But this is about evidence-based TA, and we got to stay on that. So I'm going to invite you one more round. Let's keep these lessons learned in front of us, add them to the wonderful lessons learned that Len shared, add them to the 3 pillars of of evidence-based TA that Michelle presented, and ask yourselves again, how has all of this expanded your perspective on technical assistance? What questions is it raising for you? Then we're going to move on, and Michelle's going to bring us up a level, and we're going to have a nice full conversation with questions and comments. So please take a few minutes chatting away, I hope, And at your tables, or silently if you prefer, pondering how this is expanding your view of technical assistance.
All right. All right. How about, all right. let's ring this. This is good. This is fashion. That's good. It's supposed to be inspirational. That's the part. I just want to make a couple of comments, and then we're going to turn back to the larger group discussion, and just some thoughts that kind of percolated up for me, and especially from some of the comments. And I think that what this has been able to illustrate is that this is a different way of providing technical assistance. It's specific. It's not generic. It's based on evidence and compilation and really rigorous thinking, and really pulling upon the research evidence to be able to provide recommendations for program improvement and really make considerations. The other point of it too, and I loved your comment about that relationship between the research community and the practice community, and really refining that in a way that both benefit. So practitioners come away with it with information and evidence, not this is what you should do, but a facilitated process about this is what's possible. This is what we found out as some of the areas where you can improve, as Donna showed, and then this is what's possible to you, and facilitating and supporting a process of change for them so that so that they can internalize and own their own changes. It's what makes technical assistance transformational instead of just informational. And I think I wanted to really make those points. I think, again, this conversation really raises the standards of what good quality technical assistance might look like, and how we can, again, engage the research and the practice community in a way that's more meaningful. So that, and I think, again, self-serving, but to engage the practice community, embed in research, and then further the field by learning from the changes that are made. So with that, we can go on about this. I want to point out a couple of questions, just thought questions or discussion questions for just a few minutes before Val has a chance to wrap it up. And that is, what questions or thoughts do you have about what you've learned today and what you've experienced today, not only from the content and examples of really good quality TA, but also in adult learning principles, but also the process that you've been through. So, yeah, there's a microphone.
This is Jim Verdier. When you started out, you said back in the early days, you thought there needed to be a firewall between researchers and people getting technical assistance. I think everything we've been discussing today suggests that there probably shouldn't be, and there should be a dialogue and a problem-solving interactive relationship between the TA recipients and the researchers. I don't want to put those words in your mouth, but do you think that now? And if so, what led you to sort of change your thinking over time?
It's a great question, and for me, it's about defining a permeable firewall. I think that there's an important point about maintaining objectivity when doing good quality research, and I've learned that from my experience at Mathematica. But there's conditions under which that information flow could and should go back and forth to really improve both the research quality and the practice quality. So I'm in favor more of that permeable firewall with kind of clear expectations about and boundaries about what's appropriate and what's not. So in other words, you don't want to evaluate a program that you've just changed.
Can I also add to that? I also think that when I think of research, I think there are different kinds and stages, and I think the firewall is more or less permeable at different stages of it. Excellent. So what I described, what I really want to do is I want research to inform we're not there. We don't have a model that we know. And so I think what we want is we do want research that is going to be very interactive at the beginning of that. I think when we get to the point where we feel like we have an intervention that is worth testing, that we don't want to have changed, then I think the relationship can change. But I think too often we're always at that end, and we don't use that interactive process to make things better before we enter into big experiments that we inevitably find small impacts because we're just not at the stage where we should be when we implement, to actually implement something that we can expect to have a big difference for people.
I just want to tag on to that I would actually suggest that we throw out the firewall metaphor. Because if a firewall's purpose is to keep things separate, if it's permeable, it's ineffective. And we don't, I think Donna's point about there's a different purpose at a different stage. We need a metaphor that recognizes that, and a firewall doesn't do that. If your firewall's permeable, you're in trouble. And that's not the message we want to convey when we talk about researchers and practitioners actually working together.
Good. I like that. Good.
So for the Oral Health Initiative, and we, as I had shared earlier, when we asked states to present their team, it had the usual suspects, the Medicaid folks. But we also asked them to bring a quality improvement specialist and a data person. So in one state, I think it's Kansas, they have someone from the university who's the Medicaid specialist and knows all the data. So she's participating on the team to help inform what this team is learning. And then for each of the states, they have folks from their managed care plans, if they have dental managed care, who are all about how do we measure improvement in a managed care setting, so that those folks are participating on the team.
One more, and then we'll take it from the webinar.
Just another thought on that and the whole firewall is, I think what we researchers consider objective, practitioners think of as uninformed. So I think there's a difference between, you can be objective, but we can't be completely oblivious to what the practitioner's needs are and what they're facing day to day. And so I think that's another issue too. Whatever metaphor we come up with, it's not just about, not prejudging or not, it is truly about being objective, but that doesn't mean we can't get to know them and what their concerns are and really have that dialogue. That's not breaching any sort of firewall.
It's about having appropriate boundaries between that relationship to maintain. Good. Question or comment from the webinar audience?
Sure. We've had a number of comments come in, and one of the common themes in the comments has been around the need to provide TA in a real-world context, which I think we've heard from several folks here. And this relates to, short turnaround times, confronting the political economy that they're working in. And we've also had some comments about TA needing to be, a hands-on process that involves either coaching or step-by-step working with practitioners and programs, and not just a one-time event. So,
Great. Any other quick one, please?
An example that came to mind sort of about this whole notion of technical assistance being very specific and practitioner connected is when I was a content specialist for the Georgia State CRCTM. I was actually coming from the teacher role to becoming a test developer. And so building this high stakes test, one of the things that I think was very unique and interesting is we basically took the state assessment and made modifications. The test is gone under Race to the Top, but what we did is made modifications for mostly a special education population. But one of the things we did is data and item review, which teachers come to the table and we give them a training on sort of the process of developing the assessment and the criteria we use for modifications. And so what we can do is there's items that we're about to pilot test and they can sort of give feedback on them with no data, but there's also items that we already have data on that need to be modified because they performed very poorly. And so in this space, we kind of gave them the criteria that we use on the sort of test development end from a sort of psychometric and content perspective about what motivates modifications. And teachers were able to give us the feedback of, in this context, some of these things might be very cultural, race-based, whatever, that a child is going to interpret it this way, or this is what our practice is, which is why students are missing these questions. And so it was very dialectic because we couldn't just ignore the feedback that teachers gave us about the items, and not to mention we had to have an explanation for why 20% of children answered incorrectly. And so I think for me that's a really great example of the people who might be sort of above it, there's sort of also this adversarial relationship between sort of testing and teachers. And so what it did for a lot of teachers is gave them a better perspective of how it works on this end and how they can take that information and inform their classroom practice so that it's not just performing better on the test, but understanding a better way to teach the content, because this is how it's assessed, particularly under the Common Core standards, which was very new for most teachers. There was a lot of resistance. So I think in that space, we had to, in order to do our jobs well as test developers, is to really hear what teachers were saying, find a way to appropriately integrate that information, but they were really heard in a way that is, they were basically giving us technical assistance in this space. And we had to come from our angle and make it effective and make the test better so it performs as we intended. So I just think that there's sort of a change of mindset that has to happen in those spaces to make it effective.
And my hope is that in 3 years from now, this room is full of a mix of practitioners and researchers when we revisit this conversation and have a webinar again and have a different conversation to push the field forward, that we've pushed the field forward over the next couple of years in kind of having this dialogue and expecting more and different. So,
Can I add one more thought? So in California, we're lucky to have the University of California system, and because they are a sister agency to state government, we can do interagency agreements, and we don't have to do a bidding process. So we had lots of research projects mostly with UCLA and UC San Francisco, and we had researchers in the building who could live in some ways the day-to-day experience of what does it take to collect these data, and what are the realities of developing a duals program, and how are we going to measure that over time. So they were with us understanding, okay, we're getting pressure from the governor's office on this, we're getting pressure from advocates on this, we have to, and here are all of our different audiences for research, not just Health Affairs or New England Journal, right? It's the advocacy community, it's the governor's office, it's NASHB, it's others. So it was a very fruitful relationship.
Good. Thank you. Thanks, Michelle. So for those on the webinar audience, please don't sign off yet, because adult learning theory would say that these next 2 minutes are going to be the most important 2 minutes of this whole webinar for you, and I believe that. It's not even going to be 2 minutes, actually. We're going to make it 1 minute. Please take the next minute to answer this last question for yourself. What do you personally want to share, do, or discover next after you sign off, after you walk out of these doors? What do you want to share, do, or discover next with regards to evidence-based technical assistance? You might want to jot that down. You might want to mention it to a colleague at the table. You may want to put it in your calendar. Take a moment with that question right now, and then we're going to move to wrap up.
You will be using executive function skills as you do that.
This is true.